All right, this is my take on the Pitt characters and what medical specialty they would be if they were not doing emergency medicine. First and foremost, obviously, our queen, Dr. Mel King. She would totally be either psychiatry or neurology, or she might even double board certify. People do that. I could also see her doing pediatric neurology or child psych. She has a sister that has autism. She herself may be neurodivergent. She enjoys talking to and taking care of neurodivergent patients. I think Dr. Rabinovich might actually be an ICU critical care doc. He's really good at it. And yes, he finds it very stressful, but I think something keeps bringing him back. I think Dr. Mohan would do great in the space of hematology oncology. I'm not saying this just because of her focus on that sickle cell patient, but she's also really invested in health equity, particularly bringing health equity into a space that may not have a lot of it already. I think in the world of hem-onc, we are starting now to see more and more attention being brought to diversity in clinical trials, equity from a space of like drug delivery, and I think she would be a great add to that field. Dr. McKay's day in the ED has definitely been focused on like women's health, particularly with that patient that she thought was caught in sexual trafficking, as well as with the kiddo that had the hit list of the girls. She was very receptive to the feedback that she got from Dr. Collins about doing a physical exam on a high BMI patient. I think OBGYN would be a great fit for her. I think Dr. Abbott would do like interventional cardiology. I think a lot of the cases that he did during the Pitt Fest massacre were involving vessels and the heart. She's already made it obvious in the show itself, but Dr. Santos would be either general surgery or vascular surgery. I think Santos is someone who wants to be a part of the action all the time. I could also see her as a trauma surgeon. I do want to say, however, that I know many surgeons that have great bedside manner and are nice people, and Dr. Santos has a lot to learn about just being a good doctor. I think Whitaker would be family med with a focus on rural medicine. He loves taking time with his patients. He wants to know everything, and given his personal background, I think he would truly shine in having a focus on rural medicine. I could see him going back to his hometown and opening up a clinic there. Javadi has made it really clear that she's not really up for like the high, fast pace, like go grind. She may or may not complete medical school and may decide to do something else with her life. But if she were to stay, I think she would do something that was like super high brain power, kind of like esoteric, but super competitive. Like I'm really thinking like rheumatology or derm, particularly because those specialties have better work-life balance. I think Dr. Collins genuinely liked doing a little bit of everything. I think she'd be a great hospitalist. Unfortunately, the Pitt kind of focused on her miscarriage storyline, but overall she's incredibly thorough, and I think she likes a little bit of everything. I don't know, he's a self-proclaimed adrenaline junkie with maybe a focus on procedures, maybe interventional radiology. Let me know your thoughts.